Hi, I'm Dr. Joe Kaushik, practicing in Caroline John Hospital, Nagarkoil. Today we'll talk about the complications of penile implant surgery. The first and foremost and most dreaded complication of the surgery is infection. Once an infection sets in and if it is not cured, then the only solution is to remove the implant. And we have to put the implant after the infection gets solved. That might be after 3 to 4 months or even 6 months. But at the time of reimplantation, the whole penile tissue will be fibrosed, so that the reimplantation will also be a bit difficult. The second complication is there is perforation of the corpora. Corporal perforation means the implant is not properly placed inside the corpora, so that it will come between the corpora and the skin, so that there is a chance of erosion of the penile implant, which means the implant will be coming out of the penis, and in that case also it has to be taken out. The third complication involves, this is a rare kind of complication, but it is more common in the newly doing people. This is of urethral injury. If you are not much aware of how to dilate the corpora, then there is a chance of urethral injury. So these are the common complications which we usually encounter during the penile implantation surgery. Otherwise, this surgery is completely very safe, and it can be done just under regional anesthesia, and the patient can be discharged the next day itself. Actually, there is no need of having a fear about these complications. The chances of this complication, the total any complication is out of 100 cases, there might be 2 to 3 cases might go into this complication, and that too in case of experienced hands, there is very minimal chances of complication. And in my practice, still now I have never seen not even one complication in my practice. The precautionary steps involve, we will use a very sterile OT, which means we will fumigate the OT before the surgery, and we will keep minimal staff inside the OT, so that the chance of infection will also be less. The next thing we do is we will give some protective antibiotics we will use on the nasal passage, so that the chance of infection will also be very much reduced. The other thing is, the faster we finish the surgery, the lesser the chance of infection. So combining all of this, the chances of infection will become much reduced in case of penile implant surgery. The healing usually happens within 10 to 14 days, and usually after that there will be very less chance of infection. But rarely we had seen infection after a period of 2 to 3 months. So in that cases, it might be due to a secondary injury or else improper healing of the implant which is kept inside the corpora. Otherwise, infections is very rare. Infections is not much commonly encountered.